Hello, so we'd like to welcome you guys to the Doc and Diana show today. This is Dr. Edwards. I'm Kelly Moore, the nurse practitioner here at Revolution. So today we're going to be discussing cardiovascular disease in a little bit more depth. We always have our patients say, what kind of diet should I be on? Which direction should I go? There's so many out there. What should I be doing? So, Dr. Edwards, what is your opinion on that?
Yeah, so I actually have an opinion about this, and it's a really common question. As you know, we do a lot of stuff with nutritional interventions, and there are a lot of diets. Some patients will put them on a paleo diet. Some will do just kind of some elimination diets, depending on the gut health stuff or autoimmune. There's a lot of different things that we can do. When it comes to cardiovascular disease, pretty much across the board, I'm going to recommend a traditional Mediterranean diet or a -1, -2, actually the -2 diet, but there's a lot of overlap between that, and we'll get into that in other videos. But so I would say foundationally, traditional Mediterranean diet, or the TMD, you'll see me abbreviate that quite a bit. The TMD, or traditional Mediterranean diet, has more data behind it than any other diet out there, especially for a cardiovascular disease. Okay. So without question, that's where I would start.
Okay. And so for our listeners and for our viewers, where would you, or where do you and Diana look for your recipes? Where do you go to learn a little bit more about the Mediterranean diet?
So there's some resources on the website. You know, a lot of times we'll just Google and
Okay.
what does this look like? Now, the traditional Mediterranean diet that I'm referring is there was a study called the PREDIMED study, and interestingly, and this was done out of Spain. They basically, with the traditional Mediterranean diet, it's your proteins are going to be like seafoods. Okay. You're going to get fish and those kinds of things. There are grains in it, which if you're on a paleo diet, it's not kind of cool for that. But for the traditional Mediterranean diet, that part's fine. Okay. The big issue for me, and like why the traditional Mediterranean, it boils down to a couple of things, and one of them is the kind of fats that you're going to get on a traditional Mediterranean diet, as well as the polyphenols and the nitrates and nitrites that you get in that. And all of those things are enhancing cardiovascular health. Okay. Does that make sense?
Yeah, absolutely.
So as far as the fat intake, and we've talked a little bit about the nitrates and nitrites in another video where we talked about endothelial function and some supplements that help to enhance that. You can go back and check those videos out. But as far as the healthy fats, olive oil is really foundational. Mm-hmm. That it's a huge thing. I often recommend that our patients drink olive oil, or at least consume olive oil on a regular basis. What I'm looking for is at least 2 tablespoons a day. If you have cardiovascular disease, we're looking at least 4 tablespoons a day. So you want a lot of it, and there's even some studies on even up to 8 tablespoons a day having some good effect. So 4 tablespoons a day, that's a lot. It's 40 grams of the polyphenols and things that are in there. We want good polyphenol content in that olive oil, and we're going to have another video, I think it's the next one that we're planning, is going to be on what olive oil you should take. But the benefits of olive oil, I can just ramble, right? I mean, I just talk about this stuff.
He's good at that.
So and if I step on your toes or get in your way, you just like put your hand up and say, "Shut up, let me talk for a minute." It's all good. So with olive oil, it's the fat content, but it's also the polyphenol content. And olive oil has been shown in clinical trials to improve nitric oxide, to improve endothelial health, to reduce oxidative stress, which is a huge issue in regards to cardiovascular disease. And we've talked about the 3 finite responses, where you have inflammation and oxidative stress and vascular immune dysfunction. And olive oil can help to reduce the oxidation of LDL, or low density lipoproteins. That's that, quote, bad cholesterol. I hate that term, but it is what it is. That's kind of what people identify it as. But it's the oxidized LDL, a topic of a whole nother video that we'll have to have sometime soon. That is part of the fundamental problem in causing cardiovascular disease. And olive oil can help turn off the oxidation of that LDL particle. So we see lowering in cardiovascular disease, we see improvement in blood pressure and things like that. So you've got to get olive oil as part of your diet, certainly with the foundational traditional Mediterranean diet, and then we'll be talking about where should you get your olive oil, because I have some opinions about that too.
Very nice. Look forward to hearing them.
Any other questions? You want me to shut up? It's just time to move on.
Yeah, we'll give the listeners a break.
Thanks so much for checking out this video. Be sure to like these videos. There's a subscribe button. Check that out. Be sure to subscribe. And
Also click your notifications.
there you go.
Yes.
I guess it alerts you when we put out a new video.
Yes.
And we've got a lot of videos that are going to be coming out, so you don't want to miss any of those, trying to help improve your overall health. RevolutionHealth.org. Call our clinic, 918-935-3636. We'll see you next time.